I'm Dr. JJ Thomas. Welcome to the Clinical Corner. Today we're going to talk about why your foot pain may not be from your plantar fasciitis after all. We are going to go through in a little anatomy lesson of the 4 layers of the muscles of the foot, which are oftentimes common sources of pain in the foot itself. We're going to talk about some of those options and potential causes for pain in your foot, and I'll give you some solutions for addressing those options at the end. So we're going to do our little anatomy lesson first. I have my glasses here and my iPad. I love my Visible Body 3D Anatomy app, and I'm going to screen record this so you guys can have access to the full view as we're going along here, and you can work alongside me. If you'll notice here in the foot, I'm going to give you the upside down view so we can get a good picture of the plantar fascia here, which is, again, what most people want to blame for their foot pain is this plantar fasciitis. But what I've seen clinically, and many of my colleagues have seen and now know, is that oftentimes the pain is not directly from the plantar fascia itself, but from the muscles underneath. So we're going to hide that plantar fascia, and we're going to talk about the potential causes of pain in the muscles themselves. The first layer of the foot, the most superficial layer after the plantar fascia, is made up of 3 muscles, and we're going to highlight them here. The first one is this short toe flexor. It's called flexor digitorum brevis. Then there's abductor hallucis here, and then abductor digiti minimi. The flexor digitorum brevis has a referral pattern that actually produces pain just on the base of the foot along the metatarsals like this. This guy often is a source of pain when patients come to me with metatarsalgia because the pain referral source looks just like this across the metatarsals here. When we needle this flexor digitorum brevis, that metatarsalgia gets better pretty quickly. The abductor hallucis here, which is the muscle, this one, I'm going to unhighlight it and then rehighlight it so you can see. The abductor hallucis attaches here. This one is often a contributing factor in what people call tarsal tunnel syndrome. So tarsal tunnel syndrome is an entrapment of the neurovascular structures under the tarsal tunnel, which is just above where this abductor hallucis muscle lives. Funny enough, when this abductor hallucis muscle is unhappy and tight, it will entrap those muscles and cause pseudotarsal tunnel pain. So it's really important that if you think you have symptoms like that, go see a specialist or a clinician like myself or one of my colleagues who can help you figure that out. But let's keep talking about things that you can do for yourself without seeing a practitioner right away. So we're going to remove that first layer of those 3 muscles so that we can see the next layer underneath. The next layer underneath has this first one, this quadratus plantae here. This quadratus plantae is referral pattern. When patients come to me, they have this really tough pain, like right on the calcaneus here. And oftentimes they've come to me with a diagnosis of heel spurs. And that's not necessary to say that they've had imaging that says heel spurs, but it feels like heel spurs because that muscle attaches right on that calcaneus. And like I said, it produces that deep bone type pain. When we needle that quadratus plantae, it takes up the pain pretty quickly and helps them get back their function. So quadratus plantae is the first muscle in the second layer of the muscles of the arch of the foot. The next 2 muscles in this second layer are the flexor digitorum longus, which are the long toe flexors. Interestingly enough, they come from all the way up here on the back of the leg. And the second tendon involved in that is the flexor hallucis longus, which is the big toe long flexor, which actually comes all the way from the tip of the big toe here, all the way under and attaches at the fibula back here. So again, more sources of pain and dysfunction if you have a limited big toe muscle in terms of flexibility. A lot of runners are tight in their big toe here. That flexor hallucis longus might be a source of your problem. We're going to remove that second layer so we can get to the third layer. The third layer here is made up of the short big toe flexor, flexor hallucis brevis, the adductor hallucis, which is the big toe adductor, so it helps stabilize the midfoot of the arch. And the last muscle in this group is the abductor digiti minimi, which is the little muscle on the outside of the foot, helping to stabilize the pinky for rotational forces. The big toe has, again, a lot of sources of muscular pain here. I'm not going to go through all the referral sources. Let's get to the fourth layer, which is made up of this tendon of posterior tibialis. Many people are familiar with posterior tibialis from shin splint. It's a big cause of shin splint pain. but it also helps control pronation of the foot. And then this tendon here is peroneus longus. The peroneal muscle, the longest, comes from the outside of the fibula, comes all the way down behind the fibula here, comes under the foot, and then attaches to the base of the big toe. So again, it's really important for rotational stability, but also for stability of the big toe. If you are a runner in any way, shape, or form, or if you ask your body to move in a running gait ever, then you need this muscle to help you stabilize the rotational forces. So it's, again, a big player in foot dysfunction. And then the last pieces of this layer of the foot are the interossei muscles, essentially, the deep muscles, the interossei, which help control the toes themselves and the forefoot of the toes. So as you can see, there's a lot of sources of pain and dysfunction. That also means there's a lot of opportunity for us to work with these areas to help reduce our pain and improve our function in our feet and in our bodies. What I'd like to do now is show you a couple tools that will give you some ownership over how you can treat yourself if you do have foot pain and dysfunction. One of my favorite things to teach my patients, which we have a lot of success with, is how to mobilize your own foot muscles using your own body. So you don't need a ball, you don't need a foam roller. All you need is your pretty little feet, and this is how we're going to do it. This bony prominence on the top of your foot here fits really nicely into the arch of this foot, and the way we're going to use that is, so if I want to mobilize this base foot here, what I'm going to do is take this bony prominence, place it on top of my midfoot, my arch of my foot, and then I'm just going to sit back, and then I can control my own pressure by rocking my hips, by using my hands or not using my hands, moving the weight, moving the foot, just playing around and really feeling that pressure on the arch, on the muscles of the arch of the foot. Of course, if this is uncomfortable to be in this deep knee bend, you can use pillows in lots of different ways to help support you. You can put it under the foot itself, which will change the angle a little bit, or you can put it under the knees. But essentially, just using your own body weight with your own bony prominence here on the underside of the arch will really help you mobilize that, and you can do it anywhere at any time. It's a really great tool to have in your toolbox. I'd also like to give you a muscle activation strategy to help start to rework the arches of your foot, because really, to be honest, many times when people have foot pain, it's because those muscles are not able to meet they're not able to meet the demands. They don't have the capacity to meet the demands that your foot is asking it to do. So one of our favorite exercises to give is called the short foot. The way you perform the short foot, I'm going to just kind of stagger my stance here. Hopefully you can see my foot. But what I'm going to show you with my hand too. What I want you to imagine is that if this is the floor and this is my foot, you're going to grip the floor with your toes so much so that you just get a little space on the inside of your arch. So grip the floor and just keep gripping the floor with the toes, keeping the big toe down until you get a little bit of space lifted, as if I'm going to just put a tip of a pen under this midfoot here. You'll be surprised how much you can create an arch just with some muscle activation work. So gripping the floor, getting that arch to lift a little. You can do it partially weight bearing like this. You can put yourself in like a staggered stance so you're in this position, right? And then the next level of this would be, let's load it. Let's get both feet under the hips. Let's grip the floor so we get the short foot phenomenon, and then take a weight. Do a goblet squat and maintain that arch activation while you're holding that weight. So now we're taking that arch activation, we're working all those 4 layers of the muscles of the foot, and we're loading it. So we're giving lots of sources of input to the brain, which is going to help you keep that and use it. And then after that, your body's going to feel so much better. So give those 2 tools a try. Hope the anatomy lesson helped. If nothing else, I want to make sure that I help you guys be aware that lots of foot pain is not from the plantar fascia, and there's lots of things we can do to help it. If you have any questions, feel free to reach out. Love to hear from you guys. Take care.